In today's COVID-19 update, Minister of Health Dr. Frank Anthony assures the nation that mixing COVID-19 vaccines increases the effectiveness to protect against the SARS-CoV-2 virus.
Vaccine mixing, there's reasons for that. So there are broadly two types of reasons. One is that it allows for programmatic flexibility. There are some countries who would get one vaccine for a period, they use that out, then they have another vaccine. So mixing and matching allows for that flexibility. So that's one of the reasons why the WHO has now agreed that you can mix vaccines that they have given emergency use listing to. Another reason would be that preferences of people. So it also allows for individual flexibility. And in this case, maybe somebody took a first dose of one vaccine. They had some kind of reaction. Reaction meaning that some people might experience some pain at the site, they might have a little bit of fever, a little bit of headache, things like that. These are normal reaction after a vaccine. And so on the second dose, they prefer not to get that one, and therefore it allows some flexibility of using another one. Scientifically, however, it has been shown that if you mix and match the vaccine, that you can get better efficacy. And that's really the driving reason for people to mix and match. And we have seen that done. And there are now probably about 20 or so studies that would have verified that when you mix and match, you get better outcomes. The Sputnik vaccine, for example, the first dose is different from the second dose. So that in itself is a mix and matching of vaccines that we have used. And because you're mixing and matching, the efficacy of the vaccine has been in the 90s. So it is a good strategy, and now most of the countries are now suggesting that they can mix and match, and they have been doing so. And when you mix and match, that is also acceptable as a primary course. So it's becoming more acceptable to mix and match across the world, and I think that would be the standard now that we'll see evolving. The WHO, at its recent meeting of the Strategic Advisory Group of Experts, SAGE, they met about 2 days ago, and this was a point of discussion in that meeting where they had detailed presentation on mixing and matching. They reviewed several studies pertaining to mixing and matching, and they are going to revise the WHO's guidance pertaining to mixing and matching. So if it's not out already on the website, very shortly you will see new guidance on the WHO website pertaining to mixing and matching.
More than 50% of the country's population has been immunized against COVID-19. But with the emergence of the Omicron variant, the percentage of herd immunity will have to be revised, the minister said. He added that previously, between 80 to 85% of a country's population needed to be fully immunized before herd immunity could be achieved.
So to achieve herd immunity, it depends on which variant is circulating. And with the last estimates by a number of the scientists, they were thinking against the Delta we have to be somewhere about 80-85% of the population receiving both doses of the vaccine. And they thought it was going to be difficult for people to achieve that, but nevertheless we have to try. Now with the emergence of the Omicron, which is we've just seen that recently, they might have to revise these numbers to look at what percentage of the population we need to get immunized. From what the details that we have of Omicron so far, is that it has more than 50 mutations on the virus itself, in the viral genome, with some 32 mutations on the spike protein. That's the protein that would normally attach itself to the human cell. So from these mutations, they're postulating that a number of things can happen. One is that Omicron is more transmissible, meaning that people can get infected quite easily, and some people who would have had COVID can get reinfected. Apart from the transmissibility of the Omicron variant, they also are now looking into whether or not this variant would cause more severe disease. It takes some time before that assessment can be done, because right now they're still studying the effects of this. So severe disease deaths, these are all things that would have to be studied. So again, depending on the variant, we'll have to see the calculations to know whether or not 80-85% would be adequate. Some of the recent studies that are coming out to look at vaccine effectiveness against Omicron have suggested that you would need a booster dose. And that is why you would see in some countries they have changed their policy to make sure that the eligible population can receive a booster dose. A good example of that is in the United States, in Israel, in the UK, and there are several other countries who are doing that right now. As of yesterday, we've had 405,043 persons who received their first dose vaccine. These are all adults, 18 years and older. So that would take up our first dose vaccination to 79% of our adult population. In terms of second dose, we've had 284,870 persons who would have received their second dose, and that now takes up the percentage to 55.5% of our adult population. For persons between the ages of 12 to 17, we've had 29,601 persons receiving their first dose. That's 40.6% of our adult population. And we've had 20,849 persons receiving their second dose. So that now takes it up to about 28.6% of that age cohort. For boosters, we continue to see a steady increase in booster doses. So as of yesterday, we've had 4,448 persons who would have received their booster doses.
This has been DPI's COVID-19 update. For more information, visit dpi.gov.gy or health.gov.gy and our social media platforms.